It's my pleasure to introduce this afternoon. Normally I'm speaking from here in the morning, so to introduce this afternoon Bishop Nicholas Knisely, who is the 13th Bishop of Rhode Island. And I have known Bishop Nicholas since my arrival in this country in 2008, and we worked very closely and enjoyably together when he was the Dean of the Cathedral in Phoenix. And it was my great pleasure to be able to follow him, as it were, to this wonderful state of Rhode Island. Bishop Nicholas.
Thank you for asking me to speak to you this morning. As Mark said, same problem, right? I'll stand at the door and say good evening to people in the morning. I just get it all confused. Listen, I have a couple of things that I want to hit on, and I've been asked to keep my remarks short, and that's always a danger when you ask a preacher to speak. First, I want to talk to you a little bit as a business owner, and I want to talk to you as a moral leader. So the first is a business owner. Diocese of Rhode Island has about 20,000 people associated with it in one way or another. We have 50 sub-business units, if you think of it that way, and multiple schools and other institutions. I serve on a number of boards nationally and locally. So I'm speaking to you as a person who has to worry about hiring people and caring for employees. One of the things I know about all the nonprofits here in the state, that I know about nonprofits nationally, is healthcare costs have a massive impact on our bottom line. When you are paying somebody $30,000 or $40,000 to do work that is woefully underpaid and incredibly important, and you have to come up with almost that much money so that their family can have healthcare, it makes it impossible to find a business model to do the kind of charitable and nonprofit work that a community needs in a way that a community can afford. And so there are people who are unable to follow their passion to serve the community simply because they can't walk away from a job that provides them or their family with healthcare. And it's particularly bad if someone in that family has a pre-existing condition. If you have a pre-existing condition, it's almost as if you are being held hostage, in addition to the worries about the medical care for that person. It creates an immense friction in hiring people. I've had opportunities to hire people who I think have exactly the right talents and have the skills that we need to be able to respond creatively to a need in the community, and we cannot hire them because they can't manage to disconnect from their existing healthcare and come onto our plan. Frankly, in the Episcopal Church, we have pretty good healthcare. Expensive, but pretty good healthcare. But even then, it's difficult for people. People who are hoping to have children, people who are dealing with cancer, people who are dealing with long-term illnesses simply are unable to be hired, and jobs go unfilled. The other impact is it traps people in the wrong kinds of positions. People who are working no longer for salary, people who are working no longer because they care about the position, they're working because they have to provide healthcare for themselves or for their family. That's not good for business. When I have an employee, I want the employee to be aligned with what my business is trying to do. I don't want my employee to be slow walking because they're trapped, because they can't get the care that they deserve or need. Speaking as a moral leader, there is an unequal access to care in this country, and that is a shameful thing. It just is. The fact that the wealthy people can get good coverage and care and poor people cannot is wrong. There's no other way to frame it. It's wrong. And when we see something that's wrong, we should not let it continue. In medical ethics, you treat the person with the best skill that you can to affect the best outcome. Doctors, nurses Healthcare workers around the country are trained in that form of medical ethics. You're trained to help the patient make a choice that will make sense for the patient. But what's happening is we're having to make choices that affect the bottom line. Now, there's always going to be complications about the costs or the intensity of healthcare versus the illness and the possible outcomes, but those are pretty well managed everywhere else in the world. And we seem to be totally unable in this country to be able to deal with that. That does not make any sense to me. And when something doesn't make sense, it makes me think there's some other pushing factor at the bottom of that. We have, as people have said, the most expensive healthcare in the world, and we have, in terms of public health, one of the worst outcomes in the developed world. We're paying more and getting less. What we're doing isn't working. When what you're doing isn't working, you should stop doing that. That's a basic principle. We are now in the place where we're having to use jail as a way of treating the mentally ill. I've been an inner city parish priest for most of my career. I've worked in shelters, I've worked in soup kitchens. As Mark mentioned, we worked often with street people in inner city Phoenix. Most often people were on the street because they had existing medical conditions that were being untreated, often mental illness ones. And they would cycle into jail where they would be treated and they'd be discharged from the jail and they would go back into the jail. This is not humane, nor is it cost effective. Jails are expensive. And keeping someone in a high security prison when what they really need is an antidepressant or an anti-schizophrenic drug does not make any economic sense. As parish priest, I had the experience again and again of parishioners who were having to choose whether or not to get shelter, food, or heat over the choice of their medication. People who would have a medication prescribed and would have to ration it because they couldn't afford to take it. That's wrong. It's just wrong. And in a country like ours, we ought to be able to do what other countries around the world have managed to do. And finally, I cannot tell you how many times, having dealt with people who have untreated addiction, untreated mental illness, or other issues, I have watched them decompensate, and as best we could not save them from dying on the street. I've had direct experience of people who can't get access to health care and whose lives have ended early because of that. I believe that we will ultimately be judged. I speak as a Christian leader. Someday I'm going to have to stand in front of the light of truth and love and God. And I want to be able to say that I tried. So speaking to you as a person of faith, this is not something that's optional for us. Speaking as a person of faith. Let me just say, if you're wondering why it is that a religious leader is speaking out on what is essentially a political issue, well, I'm an Episcopalian. Perhaps you've heard of the Church of England, the established church of the British government. We made our peace with working with secular power a long time ago. We did. While we won't obviously speak out for a particular candidate, we will certainly work within the secular world for moral outcomes, whether it's climate change, health care for all, or some form of equity in housing. All of these things are ultimately moral issues, religious issues, and political issues. I invite people of faith to take action in these matters. Thank you for allowing me to speak, and I hope you will listen carefully to the speakers who follow, who will lay out the facts and the details of how we can start to change what we don't want to have as our common life. Thank you.